Well, current research has shown a strong association between physical activity and breast cancer risk and prognosis. Most of these studies are observational, where they've asked women about their physical activity levels at different times in their life, maybe in their 20s, 30s, 40s, 50s, and so on. And they followed a large number of women, probably 1,000 women, for so many years until some unfortunately developed breast cancer. And we looked back at the data among those who developed breast cancer versus those who didn't, and looked at the amount of physical activity that was reported. And these studies showed about a 40% reduction in breast cancer risk among those who were doing about 2 to 3 hours per week of moderate intensity physical activity, such as brisk walking. There's been over 50 studies similar to what I just described showing this association. That is a dose-response association, showing that more physical activity is even associated with a lower risk. So more is always better, or something's better than nothing. And so there's been 50-plus studies looking at that. Currently, in just the last year or two, there's been only 2 studies observing this or examining this question in a survivorship model, so after diagnosis of breast cancer. But they found similar results, that about 2 to 3 hours per week of physical activity was strongly associated with about a 50% reduced risk of breast cancer death. So these studies were very exciting, and showing that physical activity is somehow related to improved prognosis, decreasing recurrence and decreasing death associated with breast cancer. What has not been done, though, is really looking at what are the mechanisms of physical activity in breast cancer. So what's causing this reduced risk? So my research studies here have answered that question. We've looked at, in a clinical trial format, we've randomized women to either an exercise program or a usual care group where they do what's recommended by their oncologists. And the exercisers do about 5 days per week, 30 minutes per session of moderate intensity activity such as brisk walking. And we take a blood draw before at baseline and then 6 months after the intervention. To look at a bunch of different hormones related to prognosis, such as certain estrogens and androgens, insulin, other growth factors, cytokines, which are related to immune function as well, and body fat, which is a strong mechanism, causing an increased risk of breast cancer. We also look at the mammographic density, which is looking at the tissue composition in the breast by retrieving the woman's mammogram, and we can look at the changes in the tissue with an exercise program. So preliminary results from our study have shown that exercise favorably decreases body fat overall and intraabdominally. It also is associated with decreases in insulin and other growth factors and other hormones associated with prognosis. So it's preliminary results, and with these data, we are now hopefully going to be conducting in the next year a large multi-site trial where we look at the effect of exercise on actually decreasing recurrence and death associated with breast cancer. So we'll recruit about 1,000 women from around the country, roughly about 300 or 400 from here in Connecticut, to look at recurrence as an outcome and death as an outcome. So that'll be a 5-year-long trial. Well, in the 2 trials that have just finished completion here at Yale, we asked the women to do 150 minutes per week of moderate intensity exercise. So once again, brisk walking, bicycling, stationary bicycling, aerobics, anything that is about a 40 to 80% heart rate, maximal heart rate range. And we say 150 minutes per week, ideally, because that's the current recommended amount for cardiovascular disease prevention. We don't yet know how much is necessary for breast cancer prevention, but we're using that recommendation for heart disease. So the 150 minutes per week, you could get that over 3 days per week, 4 or 5 days per week. Ideally, we prefer 5 days per week, so about 30 minutes per session, because research has shown that 30 minutes is a good amount of time that women could put towards exercise in a given day. But if it's hard for them to do it 5 days per week, then 3 days, maybe at 45 minutes or 50 minutes per session is great. No, in fact, women don't have to, perform at vigorous intensities or train for long distance events such as marathons. However, something is better than nothing, and more is always better than less. So if women haven't historically exercised at all, or if they're currently not participating in any exercise program, starting with just 10 minutes a day is a good goal if they've never really exercised. And then hopefully by week 2 or 3, you do 2 10-minute bouts, and then maybe 3 10-minute bouts, and then maybe make each bout a little bit longer, 15, 20 minutes, and ultimately to 30 minutes per session. So that's a good goal, is to take your time over the first 2 months of starting a program to get up to the recommended amount. Well, currently here at the Cancer Center, we have a survivorship program, the Connecticut Challenge Survivorship Program, that offers cancer survivors, those who have just recently finished their adjuvant treatment, their chemotherapy or radiation, to come to the survivorship program and receive counseling on physical activity and other behaviors such as diet, and they'll also meet with a social worker. And so these counselors will help counsel them on how to increase their physical activity levels based on what what they've currently been doing or not doing. So that's one great resource that's available here at Yale University. Another option, hopefully currently, but really in the next year or a couple years, is to have health insurance companies reimburse participants or cancer survivors for joining a health club perhaps, or getting even a personal trainer to work with them individually. There are some insurance companies I know now that do reimburse for memberships at health clubs. So each individual should contact their insurance company to find out that information if it exists for them. Also, the American College of Sports Medicine and American Cancer Society are developing a certification program for personal trainers to be certified in how to exercise train cancer survivors, those who are either undergoing treatment or have finished their treatment or were diagnosed 5-10 years ago, on how to exercise train, whether it be aerobic exercise or strength training programs. And so eventually within the next year, oncologists will have there'll be a website that they could go to and find out local personal trainers who are certified in this degree, and they can set them up with their patients to work one-on-one with these. And once again, working with that personal trainer will hopefully be associated with insurance reimbursement, so the patient or participant does not have to pay out of pocket for these personal training sessions. So those are some great options. Also, just looking at information on the web as far as other physical activity resources in the community, parks, beaches, to walk at. Since the activities that are recommended are such as walking, which is low cost, can do it outside or at a gym. Just finding where those resources are is pretty easy to do on the web. And then hopefully, lastly, with more research that's being conducted currently and then in the years ahead, hopefully this research will help to further programs that may be available to cancer survivors, whether it be through the YMCAs or health clubs or at more hospitals around the country, to really make it easy to increase access for cancer survivors to exercise.